An Ambu bag, or a bag valve mask, commonly known as Ambu bag, looks like this. Comes with a mask. It feels kind of like a thick plastic, almost like it's like a balloon, a thick balloon, and it's easy to squeeze. You know, just you could actually do it with a pinky. The back of it is where you hook up the oxygen. If you don't have oxygen, it sucks in air from the atmosphere, like this. Right. And the air comes through there. When it reinflates, the air gets sucked in. You can actually look up another video. It'll explain how an Ambu bag works, but this I'm just explaining really what it's for. It comes with a cuff-inflated mask, and, well, you can take the mask off. Mine came with a swivel, which means you can turn the mask at any degree without having to take it off and reattach it. The mask comes off, obviously, and you can use it actually as a CPR pocket mask, and, you know, you just tilt the head back and kind of blow into it. It also came with a filter if you want to use it, if you want to attach the filter. And this will be good for a CPR, like this. You attach the filter, and the filter has a screen in it, like a really thick material screen, and you blow. Or you can actually hook it up to the bag. But you get less air pressure with it, so I wouldn't really recommend it. You know, who cares? You know, you want to save a patient's life. You don't really care about what's in the air at that point. And it kind of looks really big. As you can hear, it's not much air. And now when we take it off and you hear it, you're going to notice a difference. See? So the cuff, really, what the cuff does, if anyone is wondering, well, you kind of have to not be a moron, but you kind of have no clue if you don't know what the cuff is for. It keeps the air in. You can blow it up with your mouth to that blue piece right there. It's a syringe with no needle. You blow it up, but I just poke it with like a screwdriver and I blow it up. But if the cuff isn't inflated, it's really uncomfortable, and air will get out easily. So you have to keep the cuff inflated. It also came with an oral airway, which is now contaminated, but I'll wipe it down with alcohol later. It comes with an oral airway in which you put into the patient like this. You measure it like this to see if it fits the patient, and obviously it fits me. It fits me perfectly. So you take it, you go like this, you take it like this, put it into the patient, and then once it's halfway in, you twist it and you shove it back. 9 times out of 10, if the patient's conscious, which you shouldn't do it on, he'll throw up. I actually tried it with another oral airway, and I threw up a little bit. Kind of creepy shit. It's really a one-patient use only bag, but since I work I'm a lifeguard, and I'm not a big fan of paying $15 for a cheap mask like this when I can pay $15 and get a whole bag, and it's better. You can just sit there and squeeze it. And I'm demonstrating how it works actually. If you're conscious, you can use it. Some people actually use it to get not better lung capacity, but they use it to hold their breath longer. It's weird. And you can hook up an endotracheal tube to this blue thing right here. If the mask is off. Here's how it works. Well, I'm going to use it like this. You're supposed to do it like this. say the patient's base was over here, you're supposed to go 2, 1,000, 3, 1,000, 4, 1,005. 2, 1,000, 3, 1,000, 4, 1,005. 2, 1,000, 3, 1,000, 4, 1,005. And keep doing that until you intubate him or another medic arrives or you get him off to the hospital or what the hell ever. I'll use this very rarely. I don't think I'll even have to use it once. You know, it's just good to have. It folds back up actually like this. Well, yeah, I don't think it's nice one. It collapses. And in order to open it again, you just pull over here, and it actually hooks up over here. You could put an oxygen monitor, and it'll tell you if you're bagging the patient right. But, you know, you don't really need that in an emergency. All you have to look for is the chest rising. And if you have an oral airway in, you probably have a better chance of getting the air down there. But if you intubate, you have a 99.9% chance of getting the air down there because it's in the trachea, and, you know, sometimes with an Ambu bag, the air can be going into the stomach. You know, it doesn't always go into the airway sometimes. And basically why a mask isn't always good is because when aspiration occurs, which is when fluid enters the trachea, it'll block the airway and more fluid onto the lungs, and if enough fluid gets down, you have to set up a chest tube, and you don't want to do that. So, not you, but personnel. So basically that's it. Looks like this on the inside. That's it. $15.